everybody, and welcome back to another episode of Beyond Massage. So ironically, today I'm going to be talking about massage, but I'm going to be talking about modalities or different styles of massage. And the one I'm going to be really focusing on today is one that has kind of a really awkward reputation, I guess is the best way to say this, in regards to both client expectations and therapist expectations of how these sessions should go. But I'm here to kind of dismantle that and to kind of bring it back down to reality so we have a better understanding. So, deep tissue massage. It's one of the most misunderstood massage modalities out there in general, especially among clients. I've been doing massage again for now a month, and I just really see this big disconnect in how deep tissue massage is perceived. Most people think the massage should just start out and be crazy deep the entire time they're receiving the massage, and other people are actually scared to get deep tissue massage because it's been so painful or they're afraid it's going to hurt. And that really just isn't how a good deep tissue massage should work. And I am talking about this because I actually misunderstood deep tissue for a long time. For actually about the first year and a half, 2 years into my massage career, I thought that massage needed to be, pretty deep right off the bat or minimal warming up. I just didn't have a good grasp of deep tissue, and I was doing work that was too deep. I was causing clients a little too much pain. And so it wasn't really until I started studying at Woven Body Healing Arts in 2017, when I started learning the art of Thai massage. It was then that I really got to understand that the body is not just a 3D model and not just muscles in individual sense, but the body is an entire systemic whole organ, and the muscles and the fascia that work together, and that works in layers. So rather than just touching on anatomy in Thai massage studies, we really began understanding the layers of the body. Massage had always been explained to me in terms of strokes, for example, lighter effleurage strokes versus deeper strokes using your elbow, and anatomy of the muscles was taught in a very singular manner. So your bicep muscle inserts here and goes to here, and you should follow that line, or you should do cross fiber, which means going across the muscle. So your bicep goes from straight up the arm, from the forearm up into the top of the shoulder joint. So you can do cross fiber manipulation, which means going across the muscle to help break up muscle fiber tissue, right? Anyway, following that, it was just a good, refreshing thing to start learning that the body needs to work in layers. So rather than, just do these strokes and then go to deeper strokes, it was okay, first we need to loosen the skin and to loosen the fascia, which is this big white sac that actually is super connected and hyper connected to your entire body in different parts of your body. And it can be very superficial and very deep. It can go from just underneath the skin to in between the organs and the sticky white tissue that holds your body together and talks to other parts of the body when you move or receive work or do any kind of physical activity or even just sitting. Your body's talking to you at all times, and the fascia system is how that works. So to kind of go back, if the skin is non-moving, right, then how can we go deeper if we can't get that first top layer open? So if let's say I try to just do a session and I try to go too deep too quickly, and I'm trying to go to the layer that's underneath the skin or a muscle that's deeper to a more superficial muscle, right? Either A, I'm going to be working harder because there's going to be way too much resistance in both layers because the top layer is not loose enough and that layer is tight underneath that layer. Or B, it's just going to be painful to the client and cause them to tense up. Because rather than working with the different layers of proprioceptors, which are little receptors in the body that sense different types and lengths of pressure, we're just going straight to deep. And we're not actually saying hi and letting that person be comfortable with us and letting the body get comfortable with us and adjust to what's happening. Because you're an organism, so when we're working together, I have to adjust to you, you have to adjust to me, and your body's proprioception and fascia needs to adjust to that. So it entirely really defeats the purpose if a massage is going too deep too fast or so deep that it's painful. Now, there's this phrase that a lot of people associate with both exercise and massage therapy, is that no pain is no gain. But really, I completely unlearned that, and my massage sessions got better and my clients had better results because no pain is no pain. So when you're causing someone pain, right, automatically when I say the word pain, what comes to mind? Right? Hurt, ouch, no, like avoid that. So deep tissue massage can be intense, and I think it's important to really differentiate the wording. It can be intense. There's going to be moments where we're hitting tender spots, where we're hitting tender trigger points, where you might have referred pain, where I'm working on your leg and you feel that in your hip, and it can feel intense. You can feel the depth. You can feel that, but it shouldn't be to a point where your breathing starts getting shallow, where you're gritting your teeth just to get some work done. Because when you're doing that, you're actually resisting against the work, causing the therapist to work harder against you. And then you have two repelling forces, and then you're trying to force muscle tissue then, right? So it's better if we start lighter and move in slowly and deeply. And this can be done through compression. This can be done through, maybe more superficial manipulation for about, I would say usually 10 minutes is like the golden time before you can really start getting deep into those areas and have better work. And you can get better results with the client because you'll have done better work with respect to the muscles, rather than trying to forcibly open the muscles and also working against resistance, which in itself can cause things like bruising. It can cause really intense soreness. You may be sore after a deep tissue, but you never want to feel like you got hit by a bus or like you literally can't move the part of your body that was worked. I've had deep tissue massages where I had trouble moving my arm, and I thought that was normal, but that's not. You shouldn't be walking away from a massage with more pain than you came in with. Even if there is a healing period, you can still do effective work and receive effective work without it causing you to feel like that. Massage should generally feel deep, but again, you should never be clenching or resisting while you're receiving work. So what can make a deep tissue session more successful is communication and awareness. Communication between you and your therapist, or you as a therapist and the client, and also the therapist awareness and the client's awareness of what's happening and what is really going on in their body. So it's always important that you and your client or you and your therapist understand how the session is going to flow. You guys should always have a good amount of time, whether it's like 5 to 10 minutes, just to really sit down, to establish what you're going to be working on, to talk about the problems. And what this does is it gives the therapist time to actually say, okay, so this is a pain area for you. This is a daily thing that you do, or a daily biomechanic or movement that you have to do frequently. And so I think it would be good for us to do this type of work to help open up this part of the body so you can really get functioning again. It's not a fluff and buff Swedish massage. I like deep tissue a lot because it provides the opportunity for much more clinical work. And there's also this idea that you can get a full body deep tissue in 60 minutes, but the reality is you can spend 60 minutes just on like the glutes to low back to upper back for a really good deep tissue massage. And I've even had times where I've spent 2 hours just on one side of a person's body to help them open up and gain function again. And granted, that was in the Thai massage modality, but it has the same principles of slow, deep compression without forcing the layers of the tissue. So you're working with them, and that client's body is going to respond to that. Your body is going to respond when your therapist isn't just forcing their way in and is working with you very slowly. That's going to have better results, better long-term results also, because it can help your body remember, oh, like it's safe for me to relax that. It's safe for me to let go of that and for that to be there versus, like this person's digging in my shoulder, let me fight that. So always be aware, it's good to establish maybe like an intensity scale with your client during or right before you start the session. Like, hey, if you get above a 6, let me know and I'll back off, and check in with them. If they just start to melt into the session and you found a good rhythm and intuitiveness with your session, then roll with that. But if you are starting to do manipulation with your client and you notice like, oh my gosh, this person's skin is so tight, I can't even move their skin, start light. There's no reason to like deep dive into that, and help your client understand that too. And that way we can really start redoing the face of deep tissue manual therapy rather than it having this like weird reputation of being like hyper painful or it needs to be deep or it's not a good deep tissue massage. So, again, just checking in when you hit those deep trigger points is good. Be mindful of your breathing as a client and also be mindful of your breathing as the therapist. If you start working really deep and you notice their breathing's getting really shallow, check in with them, be like, hey, how's the pressure here? Is this too much? Do you need a little less? And, working with breath is probably another topic to talk about during massage, but when we lose connection with our breath, when we're not in a relaxed state, we can't really receive work. So make sure your client's relaxed. Make sure you're communicating to your therapist like, hey, that's like really intense. Can we back off a bit? I notice sometimes both clients and therapists, and I say this as someone who used to be afraid to check in with people myself, are scared to check in. Like even when the session is flowing or we can pick up that something maybe needs to change, we're afraid to check in. So communication and awareness on both sides of the fence can help make a deep tissue session be really successful. It doesn't have to be painful and it can give you relief. And as long as we understand that the body works in layers and that by opening the layers of the tissue, we can really help that person's entire body open up. So thank you for listening to this brief little episode. I hope it helped you understand deep tissue massage a little better. If anyone wants to kind of talk to me and have a little conversation about this as well, just DM me in the comments. I'd love to have a conversation about your experience or answer any additional questions about deep tissue massage for you. So thank you so much, and I'll see you in the next one.